Hi everybody, I'm Mike Reinold.
I'm Erson Religioso.
We're here today, we're going to just talk about a few myths surrounding instrument-assisted soft tissue mobilization. Erson and I have been talking about this for quite a bit, and I think it's an interesting topic because I actually do think, even though it's becoming more of a popular modality, that there's still a lot of misconceptions about the technique. So first, maybe we start off, Erson. One of the ones I hear all the time a lot is, does it have to be expensive? Why are the tools so expensive? So, what would you say to that if somebody said, I'd love to learn it, but the tools are just too expensive for me?
Yeah, without naming any big names, I mean, some of the tools are thousands of dollars for a set of 6, and another model, very popular model, actually uses, you can't even buy them for several years. You have to lease them, and they don't have to be expensive. I mean, in the end, there's nothing magic about any tools, whether it's my tools or anyone else's tools. All they are steel or plastic or wood or whatever, ceramic, whatever have you. So the tools don't have to be expensive, and the training also doesn't have to be expensive.
Yeah, and that was, my next question is always, does it have to be complicated to learn? But, I guess before we get on, even just talking about the price of it, for me, I've used tools that were, $2. $2 piece of horn from China that you can use. It's, there's definitely benefits of the different types of tools, but I think the major point is it doesn't have to be expensive. So it doesn't have to be cost prohibitive for everybody to start using this. But so bringing up what you said there at the end, then does it have to be complicated? Is this a technique that's complicated to learn, that takes a lot of training, or is this something that you can pick up pretty easy?
I mean, if you're already doing manual therapy, you're doing any kind of tissue work, it doesn't really take any, it shouldn't be complicated training. I often think it's actually pretty easy. If you release certain things in patterns, and we can even we'll go over that later in the webinar, you often make big and rapid changes, and there's nothing complex. You often don't have to do specific strokes. You don't have to just find specific points. If you release things in broad patterns, you can make rapid changes. And part of the thing that I teach in all my courses, whether it's soft tissue work or anything else, I want it to be as easy as possible. It's not rocket science. And I think in our profession and in many health professions, we try to make it as complex as possible, and you think that makes it more valid, but that's not necessarily true. I think the easier the better, and less is more.
Yeah, for me, I think there's just some basic principles that you have to know, and once you master just some of the simple things about how to use the tool and how to integrate it into your techniques, I think everybody's qualified to do this right off the bat. So I think there's an easy way to learn it, and I think there's an easy way to apply it. So.
Absolutely.
Next one I get all the time is, this probably has to do with the internet and YouTube and stuff like that, but everybody comments on the aggressiveness of the technique. Are you supposed to have this huge black and blue? My patients aren't going to like a huge black and blue. Me personally, I never have anybody get a black and blue from it. It's just the way we do it. But I guess that next myth would be then that the technique's pretty aggressive on the soft tissue. What would you say to that?
Well, a long time ago, back 8-10 years or so, I actually regularly used to bruise people, and even up until 2 years ago, I was getting to be less and less. And that was even with my hands. When I adopted tools about 5 years ago, I definitely bruised people more, because I was going on that whole fascial deformation model, that you really got to get in there and break it up. Plastic deformation, you got to push and push and push until the tissue changes. But with research showing in the past couple years that it takes between 100 and 200 pounds to deform an IT band or another tissue in the upper quarter, 1%, and even that 1% goes away in a couple years. When I started following that, I started actually lightening my strokes. And my surprise was still working on the same patterns and lightening strokes. Patients were less sore. They were red just because of the rubbing, but I haven't caused a bruise in a year or two either. And that is a big difference. And I think it really actually improved my outcomes as well. It does not, you are not deforming tissues unless you're superhuman. If you can push 200 pounds on someone, that's great. But even if you do, still 1% change.
Right, and I would say, if you're getting black and blue routinely, you're
being too aggressive.
Way too aggressive.
Right.
That's not what instrument-assisted soft tissue is about. That's again, I think just a fad that's on the internet, something that's been popularized. That it almost seems like you have to go super aggressive to have any changes. But
well, it's also taught. That model is taught by some of the other.
Yeah,
some of the other courses.
True,
yeah, because that's part of their model. And we base it off of rat tendon studies where they actually did cross friction on a rat tendon and showed that it realigned the collagen, and that's great. But it's pretty hard to realign type 1 collagen, the strongest collagen in our body. And the fascial deformation studies, that was tissue that should be easier to remodel quite a bit. You know, and fascia is not as strong as type 1 collagen. So if it takes a couple hundred pounds to deform fascia, probably not going to deform you know, tendons or type 1 collagen easily.
Right, right. You know what that reminds me of too is, you know, Tom Myers, the author of Anatomy Trains, but he often talks about foam rolling and its effect on myofascial tissue. He says, you know, you probably have to foam roll for years just to get it to change. I think it's the same concept here. You know,
right.
It's not about overloading the tissue and causing you know superficial blood vessel breakage or you know capillary damage. It's not about that. It's about
It's also not creating inflammation either.
Correct.
Some other models say you got to create a light inflammatory effect. Really, all we're doing is we're changing the neurology of the tissues. We're changing the tone. The only thing you can do probably is change tone, or according to some studies, just change the very first superficial layer of skin moving on muscle, and that's it. Anything deeper than that, we're probably not going to make changes.
All right, last myth I have then, we'll say the fourth one, I get this all the time, is some clinicians, they say, you know, I'm hesitant to start using a tool, you know, I really want to use my hands. And I feel better with my hands, I really want to, I feel like I may miss that component of it, you know, what would you say to them?
I would say that I used my hands for years, and eventually my hands got tired, and that was by the time I was in my late 20s. And that was a long time ago. Obviously, the use of tools, they spared my hands a bit. But then, you know, I would get countered and say, well, why do you use a tool if you're actually going lighter and lighter and lighter? But the thing is, if we're changing tone mainly, and tone is facilitated by touch. When you have a skin-on-skin touch, P&F guys have known this for years, you can, if an area has extra tone, if you push enough on tone, tone kind of pushes back on you because skin-to-skin touch has a facilitatory effect. So if we're trying to reduce tone to improve movement, you're actually better off using an inanimate object, and I will be actually studying this with local school in the area, with EMG studies, because I've been finding in certain very high tone areas like the masseter or the upper trap, when I've used my hands versus a tool or any inanimate object, there's much less tone in the area. So I'm going to try to back that up a little later in the year.
Yeah, that's interesting. And I would even just add to that I think using the tool, it gives you a different sense of feel. That I would say,
in addition to that, right?
I'd say it's even complementary to your hands. And I think that's, you know, maybe that's another part of the misconception as well here, but instrument-assisted soft tissue, it's not replacing your hands. It's not replacing what you do with manual therapy. It's complementing that. It's giving you just another tool for you to use there. So, you know, I would say I use, you know, both together. I almost rarely ever use them separately, my hands versus a tool. And the feedback I get from both is different, but both beneficial. So I think it's really short-sighted to just kind of say that you know, you don't get any feel from the tool. I want to feel it from my hands. And that's usually from someone that hasn't felt it before.
I would say superficially you can actually feel more.
Yeah.
Because your fingers are soft, and the tool, whether it's plastic, metal, wood, whatever, as long as it's solid, it reverberates with those superficial restrictions, which are probably the only things we can change.
Awesome.